Hi people, I'm Gia Nikita. Welcome to my channel. Today I'll be posting part 1 of a many-part series on heart diseases in pregnancy. So I had a presentation entitled Heart Disease in Pregnancy today, and I did the most to get this presentation up and running and to present it to the consultant in front of my class, because we had a tutorial and I didn't get to present it. Like when I plugged in the projector, everything just went pow and all the current was gone. And when the consultant came, he was like, well, I don't do presentations from laptop screens. And he left, and I didn't get to do the presentation. Objectives. By the end of this tutorial, students should be able to say how pregnancy can exacerbate heart conditions or cause the same. 2. Name 2 cardiac conditions, and 3 cardiac drugs that are contraindicated in pregnancy. 3. Give 6 indications for admission of cardiac disease patients. 4. Give 1 key point in the labor and delivery protocol for each stage of labor in patients with cardiac disease. 5. Give 1 complication to look out for in the puerperium period. Now, this PowerPoint presentation will cover the physiological changes in pregnancy, the prevalence and etiology of cardiac diseases in pregnancy, the classification of heart disease in pregnancy, risk factors for heart disease in pregnancy, detection of heart diseases in pregnancy, the management of cardiac diseases in terms of pre-pregnancy, antenatal indications for admission, the first, second, and third stage of labor, as well as the puerperium period. I'll give notes on specific cardiac conditions and, of course, end with the complications of heart diseases in pregnancy. Now, the physiological changes in pregnancy. These all sum up to the fact that during pregnancy, cardiac output is increased. Cardiac output, that is the work done by the heart, is considerably increased during pregnancy, and this is primarily due to the combination of increased blood volume and decreased peripheral resistance. The main aim of all these cardiovascular changes is to sufficiently perfuse all the maternal organs and the placenta. All this change in the physiology will unmask or exacerbate heart conditions because of the new state the mother is in. In early pregnancy, the increased cardiac output is primarily related to the rise in stroke volume, which increases by approximately 20%, and later in pregnancy is related to heart rate, which increases by approximately 15%. There's a 40% increase in cardiac output by the third trimester, and an additional 30% increase in labor. In terms of increased plasma volume, this leads to increased preload and increased stroke volume, which sums up to about 20% in pregnancy. There are volume changes early in the first trimester, as early as the 4th week, and the volume changes they increase up and peak at about 28 to 34 weeks. Large plasma volumes are associated with large babies and vice versa. So small plasma volumes are related to small babies. Returns to pre-pregnancy volume occurs between the 6th and the 8th week postpartum. The heart rate increases by approximately 15%, and there's also reduced systemic vascular resistance that in turn causes a reduced afterload. There are also changes in terms of the red cell volume, but I won't expound on that point because those changes don't really impact this topic as much as the other changes. Now, the heart is actually displaced upward and laterally during pregnancy, and this is because the uterus pushes up on the diaphragm. So you would expect the apex beat to be displaced to the 4th left intercostal space, and can go as far back as the anterior axillary line. In terms of auscultation, you might hear a soft ejection systolic murmur, which may be heard at the apex or in the pulmonary area. So if you hear this, you shouldn't be alarmed. It's just a flow murmur during pregnancy. Now, the incidence and etiology of cardiac diseases. An NCBI report done in January 2015 states that cardiac diseases complicate up to 4% of all pregnancies compared to 1%, which was the prevalence in the 20th century. There is currently a 15% mortality during pregnancies for cardiac diseases, which is less than before. These changes, as in an increased prevalence of cardiovascular disease, has been found in women of childbearing age because of the increased survival of patients with heart disease. More women with congenital heart disease are now living to childbearing age, so more congenital cases are seen in the antenatal care unit. In the past, acquired heart diseases was more common, such that up to 4% of pregnancies may have cardiovascular complications, despite no known prior disease. Also, the major cause of heart disease used to be rheumatic heart disease, which is now on the decline because of antibiotic treatment for Streptococcus group A infections. There was a heart disease in pregnancy clinical pattern and prevalence study, which was done in Iraq in August 2019, and it showed that valvular heart diseases took up about 34.1% of the population of cardiac diseases in pregnancy, followed by congenital heart diseases, and this was followed by cardiomyopathy, which was 29.8%, followed by pulmonary hypertension and ischemic heart disease, which was 1.6%. It's important to note that the cardiomyopathy patients, 76% of them were persons in the peripartum period. In terms of the etiology of cardiac diseases, I split it up into congenital and acquired causes. There isn't much difference in terms of the etiology of cardiac diseases overall. You should bear in mind that acquired heart diseases can happen before or during pregnancy. And like I said in the previous slide, rheumatic heart disease used to be the leading cause of heart diseases overall, but now it's actually the leading cause of acquired heart diseases in pregnancy, which is 75%. Less common causes of heart diseases include coronary artery disease, cardiomyopathy, hypertensive heart disease, and collagen vascular disorders, and syphilis. In terms of coronary artery disease, it's a rare cause because it's normally seen in our older patients. But since young people are increasingly becoming obese and have comorbidities such as diabetes, then we may see this in the younger group. Also, women are having children at older ages than previous generations, so coronary artery disease is becoming more common in pregnancy. In terms of cardiomyopathy, there is an increase in the risk of heart failure and arrhythmia and stroke. So you should look out for these complications if the heart disease is cardiomyopathy. Syphilis infection of the heart vessel in the heart can lead to narrowing of the vessels and a heart attack, and it can also cause valvulopathies. And this is the same thing that may happen in patients with collagen vascular disorders. In my next presentation, I'll talk about the classification of heart diseases in pregnancy. Thank you for watching, and I hope this was helpful.